Module Overview. By the end of this module, you will be able to rapidly and accurately recognize cardiac arrest and other life-threatening emergencies. Perform a structured scene assessment to ensure rescuer, victim, and bystander safety. Apply primary assessment techniques to determine responsiveness, breathing, and pulse. Activate the appropriate emergency response system promptly and effectively. Understand how recognition and early activation link to the chain of survival. Section 1. The critical first link in the chain of survival. In the AHA chain of survival, the first link is early recognition and activation of EMS. Without this step, advanced interventions are delayed. Survival chances drop by 7 to 10% for every minute without CPR and defibrillation. In many cardiac arrests, bystanders witness the collapse, which means early action can double or triple the chances of survival. Accreditation reference: American Heart Association, AHA, 2020 Guidelines, Part 3. Adult Basic and Advanced Life Support. Section 2. Scene Safety and Environmental Assessment. Before approaching the victim, look for hazards: traffic, fire, electricity, aggressive individuals, chemical spills. Check environmental risks: water, unstable structures, extreme heat/cold. Consider PPE: gloves, mask, eye protection, face shield. Plan your approach. Position yourself so you have an escape route if hazards escalate. Why this matters? Rescuers becoming victims reduces the number of people able to help. Some hazards, live wires, gas leaks, require specialized responders. Diagram suggestion: visual showing, stop, look, think, act process before approaching. Section 3. Primary Victim Assessment, Primary Survey. This must take no more than 10 seconds. Step 1. Check responsiveness, adults/children. Tap shoulders, shout loudly, "Are you okay?" Infants, tap soles of feet. Step 2. Assess breathing and pulse simultaneously. Breathing, look for chest rise, listen for breath sounds, feel for air movement. Pulse check. Adults, children, carotid artery, side of neck. Infants, brachial artery, inside upper arm. Step 3. Recognize cardiac arrest: unresponsive, no breathing or abnormal breathing, agonal gasps, and no pulse. Section 4. Signs and symptoms of cardiac arrest: sudden collapse, unresponsiveness to verbal or physical stimulation, absence of normal breathing or only gasping, no detectable pulse, pale or blue skin coloration, cyanosis. Case: example, a 56-year-old man collapses during a meeting. He's unresponsive, with shallow gasps and no pulse. Immediate recognition and EMS activation allows CPR to start within 20 seconds, a factor that contributes to full recovery. Section 5. Activating the emergency response system. Community setting: call 112 in Nigeria or 911 in the USA. Put your phone on speaker so you can receive CPR guidance while starting compressions. Healthcare facility: activate Code Blue or the facility's emergency system. Remote or resource-limited settings: use radios, satellite phones, or send a runner to call for help. Key communication elements: state the nature of the emergency. Unresponsive adult, not breathing, no pulse. Provide exact location: landmarks, room number, GPS coordinates if remote. Give details of interventions started, e.g., CPR in progress, AED requested. Section 6. Requesting an AED. Assign a specific person to get the AED to avoid bystander confusion. Bystander effect. Time to defibrillation is the strongest predictor of survival in shockable rhythms. Ventricular fibrillation or pulseless ventricular tachycardia. Diagram suggestion: recognition, call, AED, CPR flowchart. Section 7. Overcoming barriers to early recognition. Fear of harming the victim. Remember, CPR on a non-arrest patient is unlikely to cause serious harm. Uncertainty about cardiac arrest. If in doubt, start CPR. Cultural or social hesitation. Training and public awareness campaigns can change attitudes. Access issues. Communities should map AED locations and distribute emergency contact info. Section 8. Integration into the chain of survival. The chain of survival, AHA 2020. Early recognition and EMS activation. Early CPR with emphasis on chest compressions, rapid defibrillation, advanced life support. Post-cardiac arrest care Module 2 focuses on Link 1, but the speed and accuracy of this step affect every subsequent link. Section 9. Case studies. Case 1. Workplace collapse. A factory worker collapses during his shift. Colleagues freeze, unsure what to do. A trained staff member immediately checks responsiveness, calls 112, instructs a colleague to get the AED, and starts CPR. Victim survives with no brain injury. Case 2. Remote village farmer collapses in a rural area with no cell service. Neighbors send a motorbike rider to the nearest clinic while starting CPR. EMS arrives after 25 minutes. The patient survives due to continuous bystander compressions. Section 10. Summary. Early recognition and activation are life and death steps. Rescuers must approach safely, assess quickly, and communicate effectively. Proper execution ensures the rest of the chain of survival can function.